Well, October is Sudden Cardiac Arrest Awareness Month.
It is a great time to reiterate the importance of knowing how to do CPR and how to use an AED.
Here in Dane County, we have some of the highest cardiac arrest survival rates in the country, thanks to people willing to perform CPR. Chris Hamas is the division chief of the EMS training with the Madison Fire Department here today to show us how to do this and explain how important it is. Chris, good to see you.
Hi, Chris. Good to see you.
Thanks for having me, guys. Appreciate it.
How do you recognize that someone's having sudden cardiac arrest?
Well, you'll see someone either collapse or hear them collapse, and you might see some movement coming from them. They're still in cardiac arrest, even if you see a little bit of movement. So if someone looks like they went down on the ground and they shouldn't be on the ground, assume cardiac arrest until proven otherwise. We want you to start acting early.
And how quickly do you need to act?
Seconds, literally seconds. And really, the only reason we have the highest survival rate in the country, or one of the highest survival rates in the country, is bystander CPR and starting CPR early on these patients. So recognition of someone in cardiac arrest is hugely important. So our goal is to get more of the public trained in CPR, and the goal of promoting our community-facing CPR courses.
The more people out there that know it, the better.
Absolutely.
So run through the procedure.
You want,
Go ahead.
Sure, absolutely. I think it's the easiest way. So if you see someone down on the ground here and it doesn't look right, do a quick shake. Hey, you okay? If there's no response, I want someone to call 911. We need someone to call 911. If you're alone, get on your phone, call 911.
Call first.
Call first. Our mantra is call, push, shock.
But if there's somebody around, just please call 911.
Absolutely. Mark, would you call 911?
Got it. All right.
I'm assuming he's not having a heart beating right now. So I'm going to compress at about 100 to 120 beats a minute.
And how do you know you're going at the right rate?
Mark, do you want to sing your favorite song?
Staying alive.
There you go. So we'll go to that cadence. You can put that song in your head and go ahead and compress at that rate.
And
so again, 100 to 120 compressions a minute.
And go hard.
Push hard, push fast. Center of the chest is really what we want to emphasize.
And how long do you have to go?
Until someone takes over for you.
A paramedic or a professional?
Yeah, or until you physically cannot go on any longer. We want this to continue. Ideally, we want to get an AED on site here and identify the people that we can actually deliver a shock to and get their heart back into a perfusing rhythm.
How does the AED work?
So my best description of it, there's a misconception that it actually starts a heart. An AED actually stops a heart in a bad rhythm. So if this is my heart here, normal heartbeat is going like this. There's two rhythms that it'll shock. V-fib, which is the heart just quivering like this. The AED goes, you know what, stop it. We want to get back into a regular rhythm. Or V-tech, really fast. Stop it, back into a regular rhythm. So that's what an AED will do. It'll recognize the rhythm that the heart's in, shock it if appropriate.
But when you're stressed and someone is in a situation like this, is an AED something that's easy to follow the instructions?
These things are designed so you have zero previous knowledge of how to use them. You should be able to open it up. It'll talk you through every single step to apply it to the patient and everything that needs to be done with it.
That's assuming you're in a building or something that people don't carry these around.
They don't, for the most part. But yeah, we're really, again, promotion to get these AEDs out into community places, libraries, gyms, airports, anywhere where you got a lot of people is really good to have an AED out there.
What are the three questions it asks you on the device there?
It's pretty much the steps. It's going to be plug in the pads, put the pads on the chest, and then the shock button. So it's pretty much the steps there. It's not questions that it's
And how
asking.
quickly can you do that?
I can demonstrate it for you.
Sure.
So if I'm doing compressions, I'm going to push this on button. It's going to talk me right through it.
Apply pads to patient's bare chest.
They've got pictures right on the pads of where you should put it, right on the bare chest. So you do have to expose the chest, get down to skin.
Apply pads to patient's bare chest.
I'm going to
Plug-in pads do not touch the patient.
Now we just
Analyzing heart rhythm.
checking to see if it's in a shockable rhythm right now.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Charging.
Charge up. It'll beep when it's ready to go.
Stay clear of patient. Deliver shock
I'm
now.
clear, you're clear, everyone's clear?
Shock
And I'm going to get right
delivered.
back on the chest and
It
start
is
doing
safe
compressions
to
again.
touch the patient.
So it's really that quick to deliver a shock, and that's really what's
Begin
hugely
CPR.
important.
I would assume part of the training is just teaching people how to stay calm. I mean, you're going to go to, some people go to a panic situation.
Yeah.
They have to do this by themselves.
Yeah, and our instructors do a great job of like lowering the level of anxiety. Really, if you identify someone in a situation like this, if all you're doing is calling 911, that's a start. If all you're doing is just pushing on the center of the chest, that's a great thing to do. You don't have to do mouth to mouth anymore. We're not. That scared a lot of people away from doing CPR. And most important thing is getting on that chest, pushing hard, pushing fast.
And it's so important to learn this.
Yeah, it really is. Makes a difference.
Yeah, and you teach classes every month at the fire department, and you've got 2 coming up in November.
We do, yeah. Actually, the last Wednesday of every month, we started offering community-facing CPR courses, free to the public. They're not certification levels, they're just awareness level of how to run an AED, how to do compression-only CPR. We encourage anyone to sign on up, or we're going to rotate them around fire stations around the city.
Are they free?
They are free.
Oh, that's wonderful.
So it's November, in November.
November, we have 2 classes on every Wednesday, last Wednesday of the month. It'll be November 29th. You can go to www.madisonfire.org, sign up right on our website.
And save a life.
Yeah, that'd be great. It takes a village. We need all the help we can get out there until we get
it's
there.
very important.
Chris, thank you.
Great
Thank
to
you guys
see you,
very much
Chris.
for
Thank
having
you
us.
so much.